Welcome to The Dot, the podcast that aims to bring you closer to the heart of healthcare. I'm your host, Josh Messersmith, and with Jenna Smalley, in each episode, we'll be diving deep into the world of Wyandotte Memorial Hospital, exploring the incredible services we provide to our community. Join us as we connect with our dedicated medical providers who work day in and day out to ensure our community's well-being. From doctors and nurses to specialists and therapists, we'll bring you insightful conversations that shed light on the outstanding care available at our local hospital. Today, we are excited to have Jen Frey, a certified nurse practitioner who has over 25 years of healthcare experience. Jen provides care to patients at the Wyandotte Medical Providers at Forest, and she also collaborates with the GI group at Wyandotte Specialty Providers on main campus. Joining her today is Amy Brown, a dedicated and knowledgeable pharmacist at WMH, where she brings her expertise in medication management and patient counseling. Amy plays a key role in ensuring safe and effective medication use for patients across various departments. She collaborates with Jen Frey to tailor regimens that support patients' weight loss goals and overall health. Together, we'll unravel the complexities of modern medicine, demystify procedures and treatments, and educate ourselves on the latest medical advancements. Whether it's discussing cutting-edge technologies or the importance of preventative care, The Dot is here to empower you with the knowledge that can make real difference in your life. So grab a cup of coffee, sit back, and tune in as we embark on the journey to explore the world of Wyandotte Memorial Hospital.
Welcome to the show now. We'll dive in deep. Your health and the wellness in your hands to keep. Tips and tricks to know now. Stories that inspire. Living life with knowledge. Set your mind on fire. Tune into The Dot. Health from head to toe. Together we'll unlock the secrets you should know.
Welcome, Jen and Amy. Thank you so much for coming today and kind of being a part of this new opportunity that we have with the podcast. We're seeing that we're engaging quite a bit of the community with these, and so we like to be able to share some of the different services that we have, and especially kicking off the new year. I'm always big on the new year, new me type of mindset, and then it tends to be new year, same me. You know, I was just showing Jen before this that I have all of the Reese cups still sitting on my desk. So unfortunately, I haven't made the lifestyle change that I need to make just yet. But we're excited to talk about how you can make those new changes in the different services that we offer here at the hospital now. So before we get into, our weight management program and lifestyles that we need to create to create a more sustainable lifestyle, let's get into a little bit about you both. So, Jen, we're going to start with you. So you've been at the hospital for over 25 years.
31 years.
Oh my gosh.
In August. It'll be 32 this coming August.
That is amazing. Yep. So explain to us your journey. So you have a unique experience here. So tell us about that.
Yes. So my mother actually worked here. I kind of grew up here. She was a nurse's aide here for many, many years, retired from here. So my senior year of high school, I actually started working in the kitchen. I washed dishes. I was able to get out of school like half a day early, so I would come work and did that until I graduated. And then the year I graduated, I worked as a nurse's aide and went to nursing school and just kind of kept going from there.
So you were just in the specialty clinic, or where were you before you went to Forest to open your own?
So before I went in nursing, I've worked like ICU, med-surg. I was the med-surg manager for several years, worked in the emergency room. And then when I worked in specialty for a little while I was finishing up my degree. I work with the GI doctors, our group that comes from Akron. I work with them every Friday. And then I do, when we open Forest. Well, I worked in urgent care also prior to opening Forest. And then when we open the Forest office, then I go there Monday through Thursdays and see my primary care patients and come back here on Fridays.
That's awesome. So because Forest is just a year and a half, right?
Forest is 2 years. 2 years now.
2 years.
Yeah.
So how's it going?
It's going great.
Good.
Yeah, we're getting really busy. Things are very steady, and I think it's been really good for their community. So they're very thankful.
I think the strategic look of meeting our patients where they are and getting those off-site locations closer to our patients have been so impactful. You know, we're seeing that in Forest.
Right.
You know, Sherry Klaus in New Riggle, we're seeing her practice grow. I think having that mindset is really nice, not having to have everybody drive to Upper.
Yes.
You know, the 10 to 15 minutes that it would be.
Right. And that's one of the comments that we get is like, I can walk up here, you know, and we're a really, really relaxed office. You know, if you have a question, you walk in, you talk to Marissa, she'll get one of us. The pharmacy, like I said, if we're not there, they'll answer the question or they'll come get one of us. And the biggest thing that I've heard, you know, because they had an Ohio Health office in Forest that people were frustrated with. And one of the biggest things is I like being able to call and actually talk to a person, you know, rather than getting connected 10 different times before you can actually end up having to leave a message.
Transferred for an hour before you can even talk to a human. So that is, you kind of hinted to this, but Amy, so how long have you been at the hospital? And then you work at the pharmacy that we have in Forest too, which is connected to our primary care office.
Yeah, I do. I think I've been at the hospital now for 5, maybe 6 years at this point. Yep, I work in the Forest office. I also work at Kaler's. So I work at the pharmacy there. I stop over in the Sycamore office with the providers there. I'm kind of all over the place. Every once in a while I'm still at the hospital, but yeah, doing a lot of different things. And to piggyback off of what Jen said about the community in Forest and just the office there, they're so appreciative of the office there, especially having a pharmacy that is closer for them. If you live in Forest or live in the surrounding area, you are driving at least 15 minutes, probably more than that, like 20 minutes just to get to your closest pharmacy. So our patients, we love our patients. They're awesome. They come in, they're thankful. It's really a great environment just to have the pharmacy there and to serve the patients in that area. Growing up in that area, it's really nice to just kind of give back.
I was just going to say it has to be unique because you're from the Forest area, right?
Yep.
And then also your brother
Correct.
works at the pharmacy too. So it really is kind of a family affair.
Yeah.
That's really cool.
He is the pharmacist there. Yeah. Adam is the pharmacist there for sure. When people come in, they want to see Adam. He's the friendly face when you come in.
He has people just come in and sit.
Yeah.
And it's like cheers, you know.
Yeah.
Bar, like they just come in and sit and talk to him.
Yeah, they love Adam.
Yeah, having that sense of community and acceptance, you know, that or the idea that they feel comfortable enough to come in, sit and talk, I think also speaks to kind of the culture that Wind Up Memorial has. You know, we are a large business, but we're not so large that we forgot who we are. Right. We truly are able to impact the community that we serve.
For sure. Nice. We see that with the people coming in. This is the people we grew up with, their parents or their grandparents. We know them by name when they come in. And if we don't know the person, we get to know them pretty quickly. So it's nice to be able to kind of give back to those people that you've grown up with and just provide them a service that they need.
Mm-hmm.
Well, perfect. So let's get into a little bit about this new program. I'm saying it's new, but we've been doing it for a minute. We're finally ready and I think had enough success that we're ready to talk about it, to start promoting it, and start kind of breaking down some of the stigmatism behind the new weight loss opportunities, the weight management stuff, and, you know, truly the holistic lifestyle change that you have to make. So, Jenny, go ahead.
So starting fresh, I think the most important thing is, why is the new year such a great opportunity to reassess health, you know, someone's health, and set goals for the next coming year?
I think people just like to see the turn of the clock. You know, it's gone now from 2024 to 2025. And I'm not saying that that's necessarily the best or the worst time. You know, I think you could look at each day as being a new day and time to start. But I think people just have that kind of mindset as to like, oh, this year's done. It's been horrible. You know, next year has to be better. So I'm going to take this opportunity to, you know, make myself better as well.
Yeah, I also like the idea of looking back and giving yourself that time to reflect on your past health goals and giving yourself a little bit of credit. It's a pretty tough society and world that we live in. So looking back to say, like, you know, what did I accomplish last year? What went really well looking at my health goals, and maybe what didn't go so well? Did I not stick to my New Year's resolution, and why did the wheels fall off, and how can I make that change moving forward? So really kind of reflecting and looking at yourself as a person and saying, how did I grow in my healthcare journey, and how can I make that better, and how can I continue on that for the next coming year?
So when you're setting those goals, what are some of the what are some of the factors that people should consider when they're doing it? You know, obviously you want it to be realistic. I think I always say, you know what, I'm doing all of these extraordinary goals, and then I get to what's today, the middle of January, end of January, and I'm like, I'm not hitting any of those, so I just scrap them for the year. Right. So, what are some advice that you can give to people that are setting those realistic goals?
Well, that's the first thing. I think you need to be realistic. Like, you can't say I'm going to get up at 5 a.m. and exercise and I'm going to cut out all my carbs and, you know, set 1 or 2 small goals.
I do feel personally attacked because I think both of those
I saw the Reese's. It's fine. No, I'm the same way. Like, I told Amy last night, like, I have literally raided my children's Easter baskets because I crave sugar. Like, I'm that person. So, but you need to make sure you've got a time commitment, you know, figure out when you, like Amy said, you need to figure out what's the best time for you to exercise. Are you somebody who wants to get up in the morning and do it and get it out of the way? Are you somebody who has small children that, you know, you can't fit it into your day real realistically and you need to wait till maybe your spouse gets home so you can do something then? Support is a huge thing. You know, do you have people around you who are going to continue to eat junk and eat, you know, basically like crap, and you're going to have to be cooking meals on your own for yourself? I think those are 2 big things.
Watching your spouse eat the pizza and you're like trying to shove a salad in your mouth is probably tough. That was my day last night, and I'm like, I'm gonna have a salad, and Cole's like, well, I'm having candy. I'm like, love that for me.
Yeah, support is a big thing. I think when talking to patients, I just like to ask them what their biggest motivating factor is. Like, what is the one thing, if I ask you, why do you want to get healthy? Why do you want to lose weight? What is your main goal and motivation behind that? And then whatever they tell me, I want them to keep that at the forefront of their mind. Like, that is your biggest motivating factor. A lot of people will tell me, like, you know, I want to get healthier for my family. Maybe they have small children at home and they're realizing as these kids are getting bigger, they're a little bit faster and more active and it's harder to keep up with them. And they're just realizing I want to be present and I want to be active with my family and be able to be that parent that I want to be. Or I have patients who are grandparents and they say, I just want to be able to sit on the floor and play with my grandkids and not have the knee pain and hip pain. I just want to be overall healthier. Some people tell me, I'm tired of being tired. I just am so tired of being tired. I lack energy. I just want to feel better. I want to feel confident and better in my own body. Whatever that biggest motivating factor is for you, and everybody's is very individualized and different depending on the person, stick to that and keep that at the forefront of your mind, that is where all of the goals that you set, these small little goals that we're trying to achieve, that's the overall big goal that we're aiming for.
And I like the idea that it's not just weight management. You know, it is really figuring out what works best for that person's life. And so we talk a little bit about it has to be a holistic approach. So how does medications like semaglutide, tirzepatide, Ozempic, Wegovy, you know, all of the big buzzwords that we see in the media now, and all of the ones that have kind of gained that attention recently, how do those play a factor in making those lifestyle choices? And then how do you also figure out which one's best for you? So how does somebody know that, hey, I'm going to get semaglutide versus tirzepatide? How do they know that which one's going to work best for them?
Right. Go ahead. Amy does a little bit more with that, with figuring out kind of which one will be best for you.
Yeah. So it really just kind of depends on the person. The medications are really similar. So let me talk just a little bit about like maybe what the medications are and how they work. So they're a drug class that's called GLP-1 agonist. And I won't go into a whole pharmacology lecture on that. I'll keep it pretty simple. But GLP-1 is actually a naturally occurring hormone or a peptide in your body. So these medications are just structured to mimic that naturally occurring hormone that we have. And so that way what it does is it actually will produce effects on the body to slow down food moving out of your stomach. So it's moving a little bit slower. You feel overall a little bit fuller and you stay fuller for longer. And it also helps your brain feel satisfied. So you're a little more satisfied with the food that you're eating, and it helps with some of those cravings. We call it food noise. And so it kind of dulls and takes away some of that background food noise. So really the key use of these medications is for appetite control and to help with the effects on hunger and overall feeling full. So when you're looking at a patient and you're looking clinically like, hey, how do we decide which medication to go with? The default answer is, well, which medication is your insurance going to pay for? Unfortunately, we can look clinically and we can say this medication, they're very similar. They're brother and sister of each other. This one has this much weight loss potential and this one has this much weight loss potential. And, we're looking at side effect profile of this one versus this one. Cost also comes down to some of the factor that plays a role with this medication. So if we're the patient wants to know which medication should I go with. Clinically, I can say, hey, I think this one may be a little bit better for you. But in the end, sometimes the insurance is dictating the which medication they're going to end up on, or just the cost overall of the medicine.
So Jen, then Amy helps with getting them, the appropriate medication that's for them and really educating that. But you want to talk a little bit about that holistic approach. So it's not just coming in, seeing you and Amy, right, getting the shot and hoping that, it works forever. It's about, creating sustainable lifestyle change. So can you talk a little bit about what that change looks like?
Right. So, I think when you talk about holistic, some people don't understand, that's the whole treating the whole person, the whole body, mind, body, social aspects, all of that needs to go into play. People see this medication and they're like, I'm going to look, better in my bikini. But there really is more to it. Yes, you're treating the body. It's going to help your blood pressure. It's going to help your joints. Hopefully, as weight loss happens, cardiovascular benefits. But there are other reasons, is there some underlying mental health going on, somebody's depression or anxiety that you need to look at. And maybe that even needs to be treated beforehand before you start them on something.
Yeah. Are you not sleeping? Right. How many hours a night are you sleeping? Are you getting restful sleep?
Yeah. Like I'm a huge stress eater. So like my anxiety plays into that a lot. I will, search for anything or kind of boredom too. Like, I will avoid doing work and eat instead. So I think you need to address all of those things as well. We know that, somebody who's obese, socially, they don't want to go out and do things with their friends. I think that's the biggest thing is you need to make sure that those things are being treated first and being addressed. And again, you really need to reiterate that this is a lifestyle change. There are people that are doing it, like I said, because it's a vanity reason. They typically want to look better, which that's fine. I would never deny anybody anything for that reason, but I do want you to look at, because at some point you may need to get off of this medication. And have you made those lifestyle changes and addressed those lifestyle changes that got you kind of to that point at the beginning? So that you can keep the weight off and, make this a sustainable thing. So
what you're saying is the medication doesn't necessarily fix everything. It's kind of you have to make you have to have exercise. Yes. You have to eat healthy. You truly have to think about larger than just how many shots can I take? Right. How much can I withstand? Right. I think it's I'm sitting here and I'm listening to you both talk about this, and I think it's really interesting. And Jenna, we sit here and we hear these things during our mental when we were talking with our mental health professionals. They were saying the exact same thing, that when you're looking at your mental health, it's not just I'm here to fix one or two things. Right. It is, you have to look at your entire life. So this, I think as we're doing these, it's starting to connect to me that many of the services that we provide are interchanged or that are interconnected. Yeah. And so many of the things that healthcare does is, and I'm part of the issue because I want a one-stop fix. Yeah. And unfortunately, that doesn't always happen. And so being able to leverage many of the different departments that we have here and the different services that we offer is really great for our community because we are kind of in one general location. We cover a large umbrella of things. So I think it's super great that for people to hear that.
And to play off of that, we have all of our different departments and different specialties, but it's really nice to have providers that are looking at the patient as a whole and rather just, I'm only coming to you and I want to lose weight. That's the only thing I'm looking at. Well, that's great. I want to help you achieve that goal too. However, there might be some other things that also I'm seeing that might need addressed. And maybe I'm not the expert in doing that. I'm just a pharmacist. However, we do have people who are experts in that. So let's get you to that person who can help with that area of your lifestyle. Because again, I'm not just looking at one specific thing for you. I'm looking at you as a whole entire person.
And the dietitian, the dietary referrals are huge. Some people just they don't know what's good for them to eat and, how they can meal prep and what things they can do.
So what other opportunities are there? So Jenna and I are big into social media. So I always talk about TikTok because it's telling me everything I need. And so some of the things that you see, though, are obviously the semaglutide, the tirzepatide, but also now you're seeing the drinks that have the GLP-1 same effects, or the what is Kourtney Kardashian owns the Lemmy brand. There's like the Lemmy GLP-1 now. So when looking at those things, are there opportunities for people to do this on their own, or is it suggested to come in and talk with a medical professional?
Yeah,
It's a leading question.
Yeah, right. Definitely leaning towards talking to a medical professional rather than doing some of that stuff on your own. You know, these medications, they are prescription medications. These are FDA approved drugs. Yes, there's different ways of going about of getting these medications. However, there are serious risks associated with them. And not everybody is appropriate to be on these medications. And that's one of the big things that we make sure we do when we're assessing patients is, you know, we don't want this medication to do more harm than it is going to do good for you. So we go over a lot of different things of the side effect profile of these medications and serious complications that can happen. I mean, there's serious complications with all medications that you may be on, but just making sure that our patients are aware of what they are and what they need to do if they're experiencing those types of things. There's a lot of stuff on social media that's going to tell you, you know, this is the best diet you need to follow, or this is the new upcoming weight loss thing you need to do. There's actually studies behind these medications. We have studies that show, you know, this is weight loss potential that there is with these. Yes, there's different formulations of the medications coming out. You know, they all have different profile of how they work, how well they're going to work, what they do in the body. And everybody, again, is very individualized. So I think it's definitely a good idea to be in communication with your primary care provider. They know you and they know your health history and they know really what would be best for you. I had an example with another patient. You know, patients do well following maybe a carnivore diet. However, that's like an all meat protein type diet, you know, but that is not for everybody. I wouldn't go recommend that to somebody, one of my patients who has a lot of cardiovascular conditions or health concerns regarding that. I don't want you going out and eating a stick of butter. I don't think that's maybe the best thing for all of the patients. So just because it worked so well for somebody on social media does not mean that that is the best thing across the board. So definitely making sure that you're incorporated with some type of healthcare provider to really assess you further.
I'm doing all of those trends. I'm trying the carnivore diet. I tried the butter thing. Not for me. But Jenna, go ahead.
Amy, you mentioned, you know, there's serious side effects and stuff. How can individuals manage side effects or challenges associated with these treatments while also staying on track with their goals holistically?
Yeah, sure. So we do a lot of education up front in our clinic to try to prevent side effects. When you're looking at side effects from a medication, we will explain to patients like how does this medicine work in your body? What is this doing in your body? So when we're talking about these weight loss medications and these injection ones specifically, we know they're working on receptors throughout our GI tracts or our gut area. So it makes sense that a lot of the side effects we see from these medications are associated with that. And when you explain that to a patient, they're like, oh yeah, you're right. That does make sense. So then we can expand off of it and we can talk about more preventative type things of how can we prevent these side effects from happening? What can we do? Me being a pharmacist, I'm not a big fan of treating a drug side effect with another medication if we don't have to. So if we can talk about changing some things in your diet, whether that's what you're eating, when you're eating, how much you're eating, maybe you need to incorporate some more protein or some more fiber, encouraging hydration. Do we need to set a hydration goal? Doing all those types of things, just those non-pharmacological type changes. We talk a ton about those things really for prevention purposes rather than treatment.
Amy, you said, you know, when you were giving your answer about the importance of interacting with your primary care physician. So, Jen, can you talk a little bit from the primary care side? Because, you know, I think in not only within our organization, but even within, you know, the healthcare, you know, world, it's polarizing on each side. So, what, in your opinion, got you on board for this type of medication or this type of management style for patients? And then what kind of feedback would you give to those other providers in ways to look at this as more of a tool to utilize than something to be resistant of?
Right. So I was very skeptical of it. I thought it was a very, you know, quick fix that people were going to, which, you know, people did for a little while. They were, you know, it was a fad and that has turned into something more, obviously. But I I just kind of started diving in and reading some more stuff about it. I've started listening to a lot of podcasts on weight management. And I think, us as a whole need to look at it more as a chronic medical condition. Obesity needs to be, and I think it might be now listed as a actual chronic medical condition. So when you think of other, your high blood pressure, like I said, your cardiovascular disease, your cholesterol, those are all chronic medical conditions that you would go to your primary care to treat. So, why should you not be able to go to your primary care and get help with weight loss and have some treatment options that way as well?
If you're taking these medications, should you inform your primary care provider?
Yes,
Definitely. Yes, 100%. Yes.
I mean, think about the people who are on blood pressure medication and are taking other medications. As you lose weight, hopefully you're seeing that get better. So, all of a sudden now you've lost 15 or 20 pounds and now I'm dizzy or lightheaded throughout the day. Maybe there needs to be adjustments made to your other medications where you can start tapering some things down and making some other things better.
You talked about it, obviously losing weight helps you with your blood pressure.
Correct.
So Jenna and I did a lot of research before we came here for the podcast. So there is, I think the FDA just came out with, and Jenna, help me with what, they just cleared Ozempic and Wegovy to help treat. It was like
kidney disease, like cardiovascular stuff, heart attack, stroke.
So
like 24% or something.
It was like, it's crazy. Now, I think it came out originally for diabetics, right? And now we're seeing it help with obesity. Has there been studies long enough, or is there other impacts that people are going to see? Is it going to eventually just be a high blood pressure medicine, or is it going to be some type of a medicine that is utilized in two ways? So instead of being on it for weight loss and then being also on a high blood pressure medicine, it's something that could kind of take for both.
Sure, yeah. There's definitely studies being done about how these medications are going to be used for other conditions. We are seeing more and more conditions be approved by the FDA for these medications based on the studies that are being done. If you look at other medications, not necessarily weight loss medications, but like blood pressure medications, for example, we may use blood pressure medications to help lower somebody's blood pressure, but we also may use it for kidney protection. So it's just going to end up kind of in the same situation as some of our other medications. Like, yes, this is what it was made for and designed for, but through studies, we happen to see that it did this as well. So now it has approval for this indication also. There's a lot of drugs coming in the pipeline. So the next decade is going to be very interesting for what this looks like. Different formulations. We have oral formulations. Medications are even more effective than the ones that we have out now that are in like phase 2 trials and some different things like that. So it's going to be more and more, and for more uses that we will see these medications being used.
So it probably the idea of embracing this because it's happening, right?
Yeah.
And I think the idea of, I'm not a healthcare provider. So Jen, I'm interested in your feedback. Your patients are going to take it whether you like it or not, right? If they want it, they're going to go get it.
Yeah.
And so if we're able to create a safe and impactful environment for people to be able to utilize this, I think that goes above and beyond too.
Right.
Because there are those, those online things, those other local places that you lie about your weight, you get the shot,
right.
and you're able to you're going to have a lot of those side effects. I mean, one of the ones that I always see is pancreatitis. And so it's always stresses me out. I'm like, I don't understand what it does. So
and that's the whole, community.
Yeah.
Yeah. They don't understand the risks that's associated.
They see that I can lose a lot of weight really quickly. And all I have to do is pay my entire life.
Right. $199 a month. I know.
So I think it is the idea that we're able to create more of a safe and effective route for our patients to be able to receive effective health care,
right.
And really tailor it to them, which I think is important.
Right.
So that being said, hard pivot into kind of pricing. I think, and correct me if I'm wrong, because we'll cut this out if I am wrong. So the program that we have here at the hospital is generally cheaper than some of the other local areas or those online prescription places, correct?
Correct. Yeah. I feel like when the hospital wanted to roll this out and design this program, it was not for a monetary incentive. We were really doing it because we were seeing a need in the community. Our providers, our primary care providers, they were seeing that patients were coming to them wanting these medications. How do people get these medications? And unfortunately, patients were, we didn't have great options. So they were turning to the internet. They were turning out to doctors out in California. So I can actually say that I had a patient who was seeing a doctor online out in California, filling a prescription at our pharmacy, who really knew nothing about her healthcare, that she qualified to be on the medication. And so here's your shot, go ahead and take it. And that was that. So really we saw in our community that there was a need for this and people wanted this medication. They were going to go find this medication and we wanted a safer alternative for them. So that way they were monitored. We wanted there to be transparency between running a weight management clinic and between all of our specialists and our primary care providers, keeping it kind of locally, and then making sure we're sending documentation back and forth between the clinic and the offices so the providers kind of know what exactly is going on. So when this started, it really wasn't for the purpose of, hey, we can do this and jump on the bandwagon that everybody else is doing and making a bunch of money off of this. We really tried to roll the program out because we saw there was a need and our patients were seeking this need outside of our community, and we didn't know where those patients were getting those services from.
I think that's really across the board. At the end of the day, obviously we have to keep the lights on, but because of our independence and because of our location and our mindset, we're able to do what is best for our patients, and create and offer opportunities that are going to truly impact our community. And I think that is a really great option that we're able to have. And thank you for hitting on that, because it was on my notes to lead you to get to. But you said it without me suggesting it. So one of the things as we start to wrap up that I would like you both to talk about is, if people want more information about this, how do they get a hold of you? How do they set up an appointment? Do they have to be referred through their primary care physician? And then what happens if their primary care physician doesn't offer or support this opportunity?
So honestly, it's pretty easy. We do get a lot of referrals from other primary care offices, and they can send those straight to our office coordinator, I don't know what her technical term is. Marissa.
Yep. Call Marissa.
Yeah. She does all of Amy's scheduling, and Amy has given her the pricing options so she can review that with people over the phone. So she'll set up your initial appointment. She sets up the follow-up appointments. So she'll get referrals from some of the other primary care. Amy has some other primary care providers that are affiliated, and if not, then they will meet with me. We just have a one-time visit so we can establish the relationship, and then I will be the one prescribing the medication for them and anything needed to treat any side effects or anything like that. But if you do have a primary care that's affiliated and willing to do that, then they can, take that role on.
Yeah, definitely talk to your primary care doctor, just because you never know. You may qualify to be on this medication and your insurance might pay for it. So if you're interested in these medications, have that conversation. Yes, have the conversation with your primary care provider, see what that looks like, see if your insurance would approve it, what the cost is going to look like for you. If that is not an option, our clinic is always an option to try to be able to fill that need. So yes, we take referrals from other providers. We have patients though that are in our community that may not see a Wyandotte Memorial primary care provider. And if that's the case, then Jen services that need for us. So they come in and they see Jen, and that's kind of how that works for people who are not maybe affiliated with a Wyandotte Memorial provider.
Amy, you kind of talked about it a little bit earlier, or Jen, some of us have talked about it. Can you kind of go over any misconceptions that there are within the community about the weight loss shot?
Yeah. So with these medications, there's a couple of misconceptions that I do see. I feel like people think that, and we touched on this, that the medications are a quick fix. Yes, these medications, they work. They help people lose weight. However, they're really best used along with lifestyle changes. So it's not necessarily a quick fix. It might help in the short term, but for long-term weight management, really, we need to make sure that we're including all of those lifestyle changes. Another one I see is that people are using this medication as a way to cheat to lose weight, that people think that, oh, well, yeah, they're on that. Well, they're cheating.
Yeah. You will lose weight regardless of what you eat.
Exactly.
You can eat, like we said, you can eat a box of Little Debbie's and you're still going to lose weight because that might be the only thing you're eating.
Yeah. So, and unfortunately, we see people that, they follow those types of diets, and that's not what we want. There's really a stereotype surrounding these medications that people are only using them for the cosmetic reasons. Right. But truly, there is a deeper use to these medications, and we're really seeing more and more of them. I feel like of the majority of patients that are coming to our clinic are truly wanting to make a change, and they're overall wanting to be healthier. Just because we know that weight and obesity play such a large role in other chronic conditions, like we've talked about, hypertension, high blood pressure, high cholesterol, sleep apnea, osteoarthritis, diabetes. There's a whole slew of different chronic conditions that weight does affect. So this isn't just somebody who's trying to cheat to lose weight, to get to a goal weight of a number that they have in their mind. People really have a deeper meaning of, why they're doing this. So
it is a chronic illness that you can treat. And that sometimes you can do all of the things. You can work out, you can eat healthy, and you still not lose weight. And so sometimes people do need that, that extra little, that kind of push to get there, which is, I think that's when you start to look at New Year, New Me, people get discouraged because I'm eating the salad, I'm working out every day, I'm up at 5 a.m.
Right.
And I'm still not losing weight.
Right. Yep.
It could be something where you need to get with your primary care or with this program to be able to start to see results.
Right. But again, that's kind of your whole holistic approach. Is there an underlying thyroid factor that maybe is contributing to why you can't lose weight? Amy goes into a lot with the majority of the women because of the hormones. If somebody's menopausal and they're struggling to lose weight, all of that plays a huge factor into things. So, and it is very frustrating for people because they do, they truly have tried. That they have really put their effort into this and they're struggling. And so
which also probably takes into that, the account of mental health.
Right.
So it wears on you that I'm doing everything I can and I'm still not seeing a result. So it really is, you've opened my eye, especially here. I mean, we've done a lot of research. I've done everything. I'm on board, but you guys have given me a different outlook of what it truly looks like. I think for that patient.
I think a lot of people, that's where they start out. That's where kind of those misconceptions come from at first. Because I know Jen mentioned it. I was kind of the same way. I was like,
very skeptical.
Yeah, these medications, this is for cosmetic reasons. I don't need to worry about a weight management clinic, and that's very superficial thinking. When you actually start reading studies and you start seeing the results of patients, and you see how life changing this is for some people who truly are embracing the whole lifestyle change, and they're utilizing these medications as a tool or an aid to help them get to their goal and achieve those long-term standing weight loss results. It makes you look at it differently. You definitely look at these medications and you say, no longer is this really just something that's cosmetic to help somebody lose 5-10 pounds. Right. People are having life-changing results with these medications when they're utilizing it correctly along with the diet and exercise. And that's when you, as a provider and a health practitioner, you start looking at the medications a little bit differently, and you say, we utilize medications for all kinds of things. This is just another tool to help patients achieve a healthier lifestyle and get them there, get them maybe motivated. I think Jen and I both practice very similarly, and I would like to speak on that for all of our other providers at our hospital, that I don't think anybody is truly just handing this medicine out here and saying, here's your medicine, go out, you take it, you lose weight. We're all kind of looking at saying, there are underlying causes that might be, we need to address. Maybe that is just inactivity, or maybe it is just your diet overall and how you're eating, and those are the things we need to address. Maybe it's not something like of a chronic condition that's going on, but what is it and how can we help that person? How can we aid them and just use this medication as a tool to truly achieve that goal that we're trying to obtain?
Thank you both for coming today. Thank you for coming today, for being a part of this, for dealing with kind of our questions that we have and the different ways that we ask them. But also thank you for being willing to have this opportunity for our patients.
Absolutely.
And something that is setting us apart from those other competitors that we have, and giving this opportunity to our patients to truly make a lifestyle change and truly help our patients in more of a holistic way and being the impact that we can have in our community. So thank you so much for coming here. Thank you for allowing us to kick off the new year with this. I hope that anybody that's listening knows or follows us on social media so they can start to see some of this, that we're finally ready to start advertising and pushing this and having more of an impact. So thank you so much.
Absolutely.
And if there's anything that you need, never hesitate to reach out.
Thank you.
Yeah, thanks.
Thank you for joining us as we welcome Jen Frey and Amy Brown to share their insights about building a healthier lifestyle. We emphasize that creating a healthier lifestyle is a holistic journey shaped by individual choices, mental well-being, and personal aspirations. Jen and Amy are committed to offering personalized guidance, practical tools, and unwavering support to help each person thrive on their unique path. Remember, building a healthier lifestyle isn't about quick fixes. It's about setting meaningful goals and cultivating sustainable habits that lead to long-term well-being in a more fulfilling life. For more information about this service, you can call Windup Medical Providers at Forest at 419-273-5104. We look forward to bringing you more stories and insights from our incredible team of medical providers in future episodes. Until next time, stay healthy, stay informed, and take care of each other.
The secrets you should know.